following right along with Dr. West's presentation, we're going to stay in LA County, but this time talking about vaccination rate disparities and specifically in terms of COVID-19. So in addition to my work at UCI, I also co-chair the steering committee for the Immunization Coalition of LA County. So a lot of these things are derived from some work group and other experiences through the vaccination effort in Los Angeles County. Next slide, please. So just a little bit more background on Los Angeles County, and I think we talked about some of these things already, but our population is right around 10 million. So we are the largest by population county in the United States, and of course, home to the second largest city in the United States. Notably for this material, we are a majority minority county, meaning that a minority of our population is non-Hispanic white. In addition, a large proportion of the residents of LA County are not US born. And we do have 14 current threshold languages. So these are languages that a large proportion, about 5% or greater of the population speak as their primary language. So a large racial, ethnic, cultural diversity in Los Angeles County. In addition, a lot of economic disparity. So 13.4% poverty rate, and you can see the chart there, the differences in median household income based on racial and ethnic groups. So you can see a large disparity, particularly with our Black and Hispanic neighbors. Next slide, please. So COVID-19 in Los Angeles follows, a similar story, but a little bit more intensive. With we had a really significant wave of cases through the late fall and early winter of 2020, 2021. We have so far had over 1.24 million cases and more than 24,000 deaths just in Los Angeles County. We have come a long way. So our recent 7-day average, only 221 cases per day and only 7 deaths per day. And this is not to minimize, even those lower numbers of deaths are still significant, but we've come a long way since that peak in early January. Next slide, please. Unfortunately, though, just looking at those raw numbers does not tell us the whole story of COVID. And this is true whether you're looking at Los Angeles County, California, the United States, even globally. So areas where we see large clusters of cases, cumulative cases. So, and you probably will recognize some of these from Dr. Wiss's presentation. So South LA was probably the most hard hit area of Los Angeles County when it comes to COVID cases. And this is the neighborhoods where, you're hearing stories of entire families being infected and sometimes, multiple generations having COVID-related fatalities. So you can see there is not an even distribution of COVID cases in Los Angeles by any means. Next slide, please. In terms of our vaccinations for Los Angeles County, so we've made a lot of progress, of course. Our vaccination data is a little bit, lags a little bit behind our case data because of some of the reporting processes, but so far we've administered getting close to 10 million doses in LA County. We have about 62% of our adult and older adolescent population vaccinated. There's a little bit of cross-pollination with some of our neighboring counties when we look at these numbers, because some people who, for example, live in Orange County may have received their vaccine in LA County and vice versa. So there's a little difference in the way that those are reported. We also have a really high rate of seniors being vaccinated, so close to 84% having received at least 1 dose. Next slide, please. But again, if we just look at the raw numbers, it doesn't tell us the whole story. So we do have persistent and significant disparities in the rates of vaccination, particularly with our Black, African American, and Latinx populations in LA County. You can see them struggling far behind especially our Asian and white population. And this is true both of our 16 plus population as a whole, and also as our 65 plus population separately. Next slide, please. So this just shows, similar mapping for vaccination rates in the county, and you can see some of those areas. So the lighter or brown colors are lower vaccination rates, where the darker greener colors are higher vaccination rates. So we have, kind of overcome our main peak of vaccine administration, and I think this is something that was expected. We reached a lot of people very quickly, but we're getting to the point where, the people who have the ability and the resources to access a mass vaccination site, they have done so. So we've kind of moved on to a next phase where it's going to take considerably more resources and effort to reach additional numbers of people for vaccination. So we have kind of shifted, and that's why you see that pretty significant drop off since early April in terms of weekly vaccinations. Next slide, please. But I did also want to just kind of point out the discrepancy here, where you're seeing communities with the highest impact from COVID are the exact same communities that have the lowest vaccination rates. And I think this is true for a variety of reasons. I think access is a big part of it. I think hesitancy for a number of reasons is also a big part of it. But I think it really points out the imperative that we have to focus very heavily on these communities that need additional resources, additional access to vaccinations, because they are the ones who have suffered the most from this pandemic. Next slide, please. So circling then back to our pharmacist roles, and I will say that I don't think I've had a prouder moment as a pharmacist than working in some of these mass vaccination sites, whether it was at UCI, vaccinating patients at the clinic where I work, and seeing pharmacists really covering every role. So we have been involved with the public health and planning. We have covered essentially every inch of what we're calling that last mile from distribution until the shot in the arm, and this is true at pharmacies, at our mass vaccination sites, at clinics, hospitals, and assisted living. I think there are not other professionals who are able to follow a vaccine all the way from distribution, storage, dose preparation, patient education, and actual vaccine administration, and even the management of side effects. So pharmacists are the only ones, maybe we aren't the only ones with that, the legal authority to do those things, but I have not seen a physician administer a vaccine. I have not seen, a nurse be involved with vaccine storage. So while I think our interprofessional collaboration is extraordinarily important, I think pharmacists have been, kind of the leaders through a lot of this process. And in LA County, we've also been able to be involved with what we're kind of calling our hyper-local vaccine expertise and administration, where we have found that people respond much more positively to the expertise of someone who lives in their neighborhood, who they regularly get their prescriptions from or see for their regular medical care, compared to, a nationally recognized expert at Cedars-Sinai or UCLA. So I think pharmacists have done a lot in terms of promoting vaccinations in LA County. Next slide, please. But unfortunately, I think what Dr. Wissa's study points out is that we are an answer, but we are not the whole answer. So there's a lot of reliance, I think, on pharmacists and pharmacies to be the ones to now vaccinate in communities who maybe didn't have access or didn't have, had concerns with a large government-run mass vaccination site. But those are also the same communities that may not have the same access to a pharmacist that a lot of the communities who already have received their vaccinations do. So you can see, essentially a mirror image again, where the communities that were hardest hit, have the lowest vaccination rates, now may also not have the same access to a pharmacist. So I think this is a really important piece of information for public health to be able to give additional resources for vaccinating in some of these communities. Next slide, please. And then I did just want to touch very quickly on some vaccine disparities that go outside of COVID-19. This is certainly not the first time. This is not something that's new or unique to COVID vaccinations by any means. This is some national data now, and this is from 2017, looking at changes in disparities. And you can see, historic disparities in Black, non-Hispanic, and also our Hispanic population. And also for some of these vaccines, those disparities are continuing to get worse, not better. And I did want to particularly point out the pneumococcal vaccination to show that for our over 65 population, where this is a routine vaccine, we do see a persistent disparity. However, there's not that same, there's not that same initial optic when we look at our younger patients, but I think the explanation for this is that the indications for pneumococcal vaccinations in our younger populations are those that tend to affect minority communities more. So things like smoking, asthma, that we know have higher incidence in, especially in our Black population. So while this may look like a lack of disparity in this one area, I think it's really just a mirror image of another different disparity. Next slide, please. And we've actually seen something very similar in some research that we are currently working on in a research group here at UCI with Dr. Chan and Dr. Wissa both involved here. And these numbers are a little different. These are not straight vaccination rates like on the previous slide. So these are percentages of a cohort who fall into either of these racial or ethnic groups. But we can see again, significant underrepresentation, especially in our Black and Hispanic populations in each of our vaccination cohorts, with the exception of that pneumococcal younger age group, where we actually see a statistical overrepresentation. But again, we haven't run specific numbers to find out whether this is definitely the case, but I really strongly suspect that it's because these patients have much higher risk and incidence for indications for this vaccine. Next slide, please. And that is all I have. Thank you so much.